Hello, my name is Lauren. I'll be your nurse this evening. Can I have your name and your birth date? At this time, the patient will state their name and their birth date. I'll let them know that I will be doing a musculoskeletal assessment on them. I took a full set of vital signs. The vital signs were within normal limits and the patient has no pain at this time. I'll perform hand hygiene, then I'll start my assessment. Okay, now I'm going to ask the patient some subjective info before starting the examination. I'll ask them if they have any pain or any stiffness in their joints. I'll ask if they have a history of trauma like fractures, dislocations. I'll ask them if they have any self-care deficits such as trouble bathing, using the bathroom, or dressing themselves. And now I'm going to start off with the examination portion. I'm going to first start with asking them to walk at least 4 to 5 steps for me and then walk back. I'm assessing their gait to assess if it's normal. I'm then going to have them do the tandem walking, which is the heel to toe walk, and this is to assess their balance. Okay, now I'm going to perform the Romberg test. I'm going to ask them to put their feet together, their toes pointed towards me, and their hands at their sides. Then I'm going to ask them to close their eyes. I'm going to provide a safety net with both my hands at their side. And I'm going to watch them for at least 20 seconds. I'm going to observe for their balance and if there's any swaying in their movement. Okay, now I'm going to ask them to turn around. I'm going to ask them to bend down to touch their toes. Here I'm going to assess for the S curvature of the spine. I'm going to palpate on the areas around the spine to see if there's any tenderness or pain. Here I'm going to be assessing if there's any signs of scoliosis. Okay, now I'm going to move on with inspecting both the arms, inspecting for abnormalities, any skin color changes. Then I'm going to move on with palpating both arms, assessing for muscle symmetry. I'm asking them if they have any pain, and I'm noting the temperature in both arms. Okay, now I'm going to assess my patient's muscle strength. I'm going to have them push back onto my hand and then push forward onto my hand. And again with their arm, forward, and then assessing their wrist for their muscle strength. I'm going to perform this on both sides. Okay, now I'm going to assess for equal strength in their hand grips. I'm going to have them squeeze my fingers, and I'm going to assess that on both sides. Okay, now I'm going to assess my patient's joint range of motion. I'm going to ask them to lift up their arm. I'm then going to tell them to put their arm across their chest. Then I'm going to have them reach for their back. And then I'm going to have them put their arm towards their back. And assessing if there's any lack of motion or any pain. Okay, now I'm going to assess my patient's supination and pronation movements. For supination, I'm going to have them put their hands outwards. And then for pronation, I'm going to have them put their hands down. Then I'm going to assess their clenched wrists. I'm going to have them clench their hands. And I'm going to have them unclench their hands. I'm going to assess for any pain or discomfort. Okay, now I'm going to assess for any crepitus within the joint movements. I'm going to put my hand in this section of the arm and behind, and I'm going to have them perform flexion and extension of the joint, and I'm going to feel for clicking or crunching sensation. Okay, I'm going to move on with also assessing the wrist for any crepitus. I'm going to have them flex and extend their wrist, and I'm going to assess for any of the clicking or crunching sensation. Now I'm going to move on with palpating the radial and brachial artery. I'm going to assess them bilaterally, checking for the normal rate and rhythm. And again with the brachial artery, assessing the rate and rhythm, and +2 is normal. Okay, now I'm going to move on with the lower half of the body. I'm going to start off with inspecting both the legs. I'm going to look for symmetry. I'm going to look for any swelling or any skin discolorations. I'm going to then move on to palpate both extremities, checking for muscle symmetry. I'm assessing the temperature. And I'm assessing if the patient has any pain or discomfort. Okay, now I'm going to assess the muscle strength in the hip. I'm going to place my hand on their thigh and have them perform flexion and extension on each side. Okay, then I'm going to do the same thing with the lower extremities. I'm going to have them perform flexion and extension. Then I'm going to move on and check the range of motion in the knee. I'm going to put both hands around the knee. I'm going to have them perform flexion and extension again. I'm going to assess for any crepitus, any pain or discomfort. Again on both sides, flexion or extension. Now I'm going to perform range of motion in the ankle. I'm going to put my hands around the ankle and have them move in a circular motion in each ankle, assessing for any crepitus and assessing if they have any pain or discomfort. Okay, now I'm going to move on with checking the dorsalis pedis pulse, checking the rate and rhythm, make sure they're equal bilaterally. And then I'm going to move on with checking the posterior tibial pulse, checking rate and rhythm, and checking for equal strength bilaterally. Okay, now that I'm done with the examination portion of the assessment, I'm going to give them some health promotion. I'm going to let them know to eat the rainbow, choose colorful foods such as green, red, and orange, yellow, purple foods. This will help lower fat mass and promote bone mass. I'm going to tell them to increase their physical activity, at least do 30 minutes, 5 days a week. This will help strengthen the bones and prevent bone loss. I'll also let them know that women ages 65 and older should get a DEXA scan, which is the bone mineral scan to assess the strength of the bones. Okay, now that I'm finished with the assessment, I'll ask my patient if they have any further questions or if there's anything they would like to add. I will perform a hand hygiene and then I'll document my findings.